and we're going to follow the research trail for hospital onset CDIs. This is a completely researched area over the last 10 years, and the answer is very clear that the environment is important and we need to do a better job. So let's start with number one. 20 to 40% of healthcare acquired infections are from the hospital environment. This was shown by Dr. Weber et al. And so we really need to realize that the surfaces in the hospital are contributing to our patients getting sick. These hospital beds are at the center of this patient care, and they move throughout the hospital from telemetry to the MICU to the PACU. These beds are not just staying in one area. They move, and now they're in a different area, potentially spreading infections to other areas of the hospital. So you have a patient in one area that has a hospital-acquired CDI. Now that bed moves after the discharge to a different area, and now we have an entirely different ward contaminated with C. diff infection. So C. diff spores persist on, this is number two, on the surface of devices and beds for months, and they serve as a reservoir for the oral fecal route of contamination. The problem is, number three, the one-step hard surface disinfectants are ineffective. There's been some talk recently about, well, this one-step disinfectant might be compatible with the surface. Well, compatibility has got nothing to do with cleaning. I'm great that it's compatible, but if it does not remove the bacteria and spores from the surface, it does no good that it didn't damage the surface. So number four, bed decks are dirtier after cleaning. So this was a study that I did where we showed that after terminal cleaning, basically they take the bacteria and spores from the surface of the mattress and then deliver them to the bed deck because they're not replacing frequently the rags that they're using. This is why the manufacturers in 2015 were mandated by the FDA to do a 3 to 6 step process to ensure that the mattress could be disinfected, and more steps for if you have C. diff. And so now all the manufacturers' beds, all the major manufacturers have mandated multiple steps. This is everything from pre-cleaning to cleaning to rinsing off the cleaner to disinfecting to rinsing off the disinfectant to inspecting. In 2017, the FDA issued a safety warning about failed mattresses. ECRI in 2019 listed failed mattresses as one of the top 10 issues in healthcare. Number 7, 86% of hospitals are not following the manufacturer's instructions for use, and Joint Commission is not happy about this. This was from an APIC conference that I spoke at. 52% had experienced failed mattresses in their hospitals. And along the same line, number 7, 72% of beds in a recent study, hospital beds, had failed in a major hospital system. 47% need a new top cover, and 25% need an entirely new mattress. If you look at the picture there, the fluid soaked through the mattress from a failed cover. And number 8, the problem is we need to get a 5-log reduction. And my study showed that if you don't get at least a 5-log reduction, you will end up transmitting C. diff. And if you're only getting a 3-log reduction, you're leaving hundreds of thousands of spores on the surface of the cover. And most of the one-step disinfectants are getting a log 1 reduction. Number 9, hospital beds are the dirtiest surface in the patient room after terminal cleaning. There's this research study that showed the most contaminated spot was that hospital bed. There's evidence that the gloved hands, you wear gloves, but you're doing multiple things, that 50% of the time the contaminated gloves, or the gloves were contaminated prior to treating the patient. Number 11, a lot of you are unaware that when a mattress is cleaned, a lot of times it's what's called dead stacked on other mattresses because it's not being used for that next patient. Well, these dead stack mattresses will become contaminated, spread bacteria from one to another, spores from one to another. And there's actually a research study showing that these contaminated mattresses these clean mattresses become recontaminated very quickly. Number 12, asymptomatic and symptomatic patients can cause healthcare-acquired infections. About 10 to 25% of patients that are asymptomatic will be spreading the disease. Number 13, mattress rentals. Boy, watch out for these. A lot of these mattresses and beds you're renting are coming in. They're not being cleaned appropriately. You can find bacteria and spores all over them. Please, if you're using a mattress rental or a bed rental, please make sure you get it cleaned before you use it in your facility. Do not assume that it came in clean. Number 14, patients have almost a 6 times likely chance of getting HAI if the previous occupant had an HAI, and almost 4 times for C. diff alone. So we've got to do a better job. These beds are not clean, they're not being cleaned, and we've got to do better. So finally, number 15, mattresses and beds can use launderable covers, and you can get greater than a log 6 reduction of C. diff spores, and obviously all the other bacteria are going to be removed too. And it reduces healthcare-acquired infections in 2 published studies by greater than 40%. So if you want to care for your patients, you need to know this information, and you need to get beds cleaned and use this launderable cover so that you can decrease your hospital-acquired CDIs and, by extension, all of your hospital-acquired infections. Thank you very much.